lock. Thank you. It's even cold. You don't want to lock the window for me, please. Hello guys, welcome again. Welcome, Alex. The doctor has finally joined us. Welcome. Please join, guys. Tell your friends about it. Share. Now the hour has come. Our Dr. Tosin is here. Kindly join. We are so sorry, guys, for going off and on. We have to make everything comfortable for everyone to join this live. Kindly join. So let's give everyone 20 minutes to join before we invite Dr. Tosin to start this program. Hello, Dr. Tosin. Hyogram. Welcome to our live today. Welcome, guys, again. Welcome. Kindly share this page, share this live so that no one misses out from this beautiful, interesting, educative live tonight. So connect. Welcome. Hello to you too. I am Toby, or the Toby Gray. Welcome, all of you. Welcome. So for someone who is coming to do masters, yes, you will still need to do selfie bras. I'm giving 20 minutes for everyone to join before we invite or we accept Dr. Tosin's request to join the live, and then we can continue from there. Please join. We are sorry for always going off and on. Like, we've gone off and on like twice now. Sorry. We apologize. Have you joined? Ashiwaju of Lagos, welcome. Sis, have you joined? Okay. I am Oida, welcome. Welcome, Ashiwaju of Lagos. Welcome, Samuel Too Big. Welcome. Kindly share the live. We have our doctor here. Share, please. You are glowing. Hey! Okay. Thank you. It's been long they commented on my glow. Thank you. I appreciate your kind gesture. Welcome, Ayodeji. So now we would get right into it because we've wasted a lot of time. We've spent almost 30 minutes trying to get you guys together. So now we're going to go in. I saw we had like 24 viewers earlier, but now it has dropped to 8 because we had to log out and log in back again to start this video. Please tell your friends about it before we start. Share to everyone. We're about to start now because the doctor is here. He has gotten home. I'm not in British. Britain. Yeah, he has joined. So now, Dr. Tosin, kindly request to join the live, please, because why you laughing? Because I don't know how. Are you live? I'm live. So let me give you guys 5 minutes. You can't see me. Okay, I can see you now. Okay. Let me see how they can request. Send a request. Go. I think it's going to be here now. Hello, cursed man. Welcome. Hello, Dr. Tosin.
Oh,
good to have you here today. Thank you for joining this live. We appreciate you and your time. Thank you very much for volunteering to educate people about medical healthcare in Brazil.
So
we're going to get right into it because of your time.
Yeah. Thank you.
Sorry. Welcome, doctor. Everyone, please welcome our doctor today. Welcome. Send some love for him, please. Korede, thank you. Annie's hairline, thank you. Welcome, doctor. Send some love, please. Oh, thank you so much. So all this love they're sending is for you, doctor. Thank you for your time. Thank you very much. Caroline, welcome. Ashwaju, thank you. Everyone should get comfortable. Welcome, Dr. Phenom 99. Thank you very much. So, without wasting much time,
Yeah.
would like to hear from
Can you
the
hear me?
doctor. Good to see you guys.
Well, can you hear me?
Good to see you too, Oluwajomiloju. So, we'd like to talk about the personal life, not too deep, doctor, not too deep. Just briefly introduce us to yourself. Kindly, briefly introduce yourself to us so that we can know who you are and what you're coming to talk about.
Okay, I am Tosin by name, and I'm a medical doctor here in Brazil. Been living here for the past 13 years, and yes, I'm currently a medical resident, specializing in orthopedic and trauma surgery. And yeah, I think that's basic, right?
Thank you very much, doctor. Let me apologize for future sake. I'm using my microphone because I want you guys to hear my voice clearly. I don't want to hear, we can't hear you, we're all of Brazil, we can't hear you. So I'm using microphone. Every time I'll have to input it so that everybody and the doctor can hear me. And then when I need to hear some answers from the doctor, I'm going to remove it. So it might take like little breaks from the whole transmission. So now let's get into healthcare. Doctor has told us that he's a Nigerian, that is a doctor, resident orthopedic surgery doctor in Brazil. He has introduced himself. Gege. So now I want to get into healthcare. Hello, doctor. Kindly tell us briefly about the Brazilian healthcare. Briefly,
Yeah.
please.
Well, let's start with the fact that Brazilian healthcare is free. It's a universal free care where you don't pay anything. Actually, you pay zero naira
Wow.
to get to use them. It is divided in 3 parts, right? From the the basic care to the more complex care. For example, the basic is the family doctors, where they attend to the population in general, and it's like a preventive medicine, where they get to know their community, like it's a community medicine, where they get to know the patients, their family, the background, not only what's it called, the health issues these patients may be having. So yeah, it's a kind of integrative, universal kind of medicine. So you know them, you know the family, you know what they eat, you know the habits, and you intervene through this knowledge about each patient to treat them, and it's like a family. So that's why it's called family doctor, yeah. And you have the more complex level that treats more complex diseases like surgeries, gynecology, and so on and so forth, psychiatry, etc.
Wow.
That's literally the basic way I can explain to people, because it's, first of all, you need to know it's free access. So even as a foreigner, if you're not Brazilian, you go to Brazil today, for example, you land to Brazil today, and you need a medical attention, definitely you're getting it for free.
Wow. Let me repeat my point. Wow. Hear that. Our doctor has told us that the medical healthcare system in Brazil is divided into 2: family doctor and the more complex.
It's actually 3. I'm sorry.
3.
Yeah, exactly.
Into some.
3. Yeah.
Okay.
But I think that's not the what you need to know. I mean, 3 things you need to know: it's integrative, it's free, and it has this free this basic to the complex what's it called? Sorry, my English is really bad. So yeah, 3 levels. So yeah, that's it.
Treating in Portuguese.
Yeah, exactly. So yeah, I'm trying my best. So bear with me, please. Yeah. So Literally, basically, that's how the healthcare system here works. It's free, like really free. For example, I have attended to an Australian when I was in school, when I was in university. She was pregnant and she was about to deliver, and we didn't even hesitate. I mean, we didn't ask for any document or whatever because she was really in an expulsion phase of a labor, and we attended to her, and it was fine. I mean, she got a baby for free, free of charge, and she was happy to go home after. So yeah, that's how easy and free it is.
She's not even a resident here, right?
Nah, she wasn't a resident yet.
Wow. Wow. That's amazing. Thank you, Doctor. My next question, trying to my mind.
Is a Nigerian. So my next question will be how much does it cost? I know you've been trying to tell us that it's free, but tell us true, doctor. Let these people know how much does it. How much is it? How much? I want you to tell me how 0 naira it's costing.
It's
Let me
zero.
to expatiate on it, please.
It is actually
how much does the healthcare in Brazil cost, please?
Zero. It costs 0 naira. $0. 0 reais. Although everybody contributes through what's it called? You call this tax, yes, but that's if you're even working or contributing. But nobody when when it's time for you to have access to it, nobody asks you if you're contributing, you're paying any tax or whatever. So yeah, it's actually free. Without discriminating, it's universal. It's integrating. I mean, it's a longitudinal kind of medicine, and yeah. Although there's some disadvantages in terms of the government's policies and all that, but yeah.
We'll get there. We'll get that question. Thank you very much. So, my next question would be briefly: who are the beneficiaries?
My next questions: who benefits from these things? Is it just for some particular people, or citizens alone, or permanent residents? Who are the beneficiaries of the primary healthcare in Brazil, please?
In terms of what? Sorry, that question again.
I mean that who are the people that enjoy healthcare? This free healthcare. You told us it's free, right?
Yeah. Everybody, a foreigner, illegal. There's no discrimination when it comes to the health sector. Yeah, I mean everybody gets an equal health. Yeah.
Wow. So this free healthcare, does it extend to like major surgery? You have cancer, you have this personal diagnosis.
Yeah, exactly.
Even child delivery, all free.
Yeah. When you're talking about what's it called? The public sector, yes, it's free. The private sector is not free, of course, yeah, but the public sector, which is 80 to 90% of all health sector in Brazil, yeah.
Thank you very much. So what is the life expectancy for a man?
You said? Can you put the microphone in your mouth?
Oh, I'm sorry.
What is the life expectancy of each individual in Brazil? How long do they expect them to die? Like, when would you live to 2030?
Actually, life expectancy here in Brazil is a little bit elevated. You can compare to parts from Europe, Asia, and even the United States. The quality of life compared to certain countries is really high, and life expectancy here is about 70 to 80. People are growing older. People are really growing older in Brazil, and there's a kind of worry between the population in general. Like, in the next 10 years, I think the major population, will be 60 and above. So we have less children, and we have more elderly people. So yes, they have a very good life expectancy.
I would even affirm to that, because the amount of old people I've seen in Brazil that are doing well, painting their nails, going to market themselves, nobody's holding them. They are doing their own thing themselves. Almost, I have experienced it, so I think that one is very, very certain. I would also want to know, somebody asked before you joined live, when we're doing it briefly in the beginning, that how can they manage sickle cell? Probably they have a daughter or a son that has sickle cell from Nigeria, and they want to bring them here. Then how can it be managed?
Well, about sickle cell here in Brazil is not quite a very, very common genetic disorder, because for example, when we're talking about malaria is not a very common or frequent disease here in Brazil. But yeah, it does exist. And talking about sickle cell anemia, there are centers specialized in treating these cases, these patients, but due to low population who possess this genetic disorder, it's difficult for you to just get into any hospital and find a sector responsible for that. But yeah, we have a good hematologist in each sector that can refer you to specific centers that carry out treatment for these patients. So, for example, I have a cancer. I need to start treatment, chemotherapy, whatever. There's always a center responsible for these treatments. That's why I said the primary takes the less what's called complex cases, and please can you?
Mommy.
Sorry, I have a little bit OCD for that. Yeah, that's it actually. If they want to calm down, it's well, they need to get a visa first. Yeah, visa, medical, what's called medical. That has a medical. I think I don't know what's called here, but I think it's a medical kind of visa. A visa, I mean, where they can come down to Brazil on the basis of, I need to get my health in order, blah blah blah. I need to see a doctor, specialist, where I can get the treatment and that, and they can refer them to a primary sector first, because that's the entrance of every case, most cases, right, in Brazil, and get to the primary sector, see the family doctor, like, which is who's going to see through the case and see if there's any necessity to extend or forward the patient to more complex hospital.
Okay, that's amazing. So, doctor, I would like for you to tell us, how lucrative is it to be a medical practitioner in Brazil? Is it worth it?
How long? It's worth it, I guess. I think most of the time I used to ask myself, why did I even go for this? I mean, am I crazy? Or my uncle is a doctor, and I think I got into this dream of wanting to be a doctor ever since I was 14 or 15. And yes, I think if you like it, it's worth it.
You're welcome.
It's actually an area where you need more dedication, perseverance, and discipline as well. We are not perfect. We're human as well, but there are times we feel like we're nothing. Like there are times we feel less. But yeah, once you put your mind into it, definitely you can get it.
Achieve it.
So to become a doctor in Brazil, you need 6 years med school.
Wow.
Then you go on to, depending on what specialization you want to, you can spend more, 3, 4, 5 years in subspecialization and specialization. For example, orthopedics is almost 5 years total.
Wow, that's interesting. What I asked initially was, is it lucrative? Is there money? in this Brazilian medicine?
There's no money in it when it comes to comparing to the amount of work a doctor does. I mean, there's no money that can pay the doctor. So yeah, I used to tell people like,
There's no
there's no amount
exactly.
of money that
There's no amount of money that is enough.
yeah.
It's true, sure. Sure, that's true. That's true. That's true. So, what are your advice to people that intend to come to Brazil to study medicine or to be a medical doctor? Because some people asked me if it's possible as a medical practitioner in other countries to relocate to Brazil to work. So they would like to know, is it possible?
Yeah, it's very possible. It's very, very possible. What you need to do is, first of all, learn the language, which is because without the
Okay.
language you can't even practice here. That's a huff. Uh,
Okay.
I'm sorry.
Okay.
Alright. Without the language, you can't actually
Do anything.
work here. So you need to at least be on the intermediary level. There's an exam you need to take, which is Selpibras. Selpibras exam is like a TOEFL, where you need to sit, write, and it consists of speaking, writing, hearing, and etc. After passing this, then you come down, you write the board exam. I'm not using filter. It's a mistake. You write what's it called? You write an exam where that enables you to join the board of medical association in Brazil. And once you get that, then you work as a general physician first, or you specialize. I mean, you go further for specialization.
Wow. Oh, that's amazing, Doctor. Thank you very much for this live. We appreciate you so much for your time. So right now, we want to ask other people if they have questions because these questions are the ones I've created and just threw from other people from the live before you joined. So
Yeah.
you guys, please, if you have questions for the doctor before he leaves, please kindly write your questions, type them here because he won't reply your DM. There's no personal question. Send it here so that everybody can learn, everybody can get informed about it. Thank you guys. When
Well,
doctor, don't go yet. Oh,
no, I'm here.
he's not going.
Just, I think what you need to know. I don't know. Let me chip in. When before people, I mean, I don't know how many people have questions and so on. But yeah, just to chip in that, yeah, medicine here in Brazil is good. I mean, it resolves a lot of things. It saves lives, a lot of lives, and I mean, it's free. That's everything. When your health is free, you can't. I mean, compared to the US, where you need to watch out even before eating anything. I mean, everything here is almost free. It's a country where the government finances the health, the university, which are public universities, right? And yeah, don't let me go off topic, but yeah, talking about the health system, yeah.
No, you can go off topic. These people are ready to learn too, aside health. If you have anything that can help us, please go ahead and share the knowledge.
But I prefer. I think I prefer questions.
Speak on health. Okay, questions. Okay. Okay. So the first question we have is, can I do nursing in Brazil? And is it in English?
Yeah, you can actually take the course here. There's no university that's going to teach you in English, unfortunately. You have to learn the language. Like you can escape it. The Portuguese language, you can't actually escape it. It's necessary, and that's what you will need to go through your graduation and whatever course you're studying in Brazil. And yeah, 5 years course of nursing, I guess, and you can specialize later. Yeah, so Definitely, it's possible for you to study. First thing first, which is a Portuguese language. I mean, you can skip that.
You cannot skip Portuguese. My friend, what's her name? Margarita Spanish. You cannot. Spanish is in your name. You cannot skip Portuguese. You have to learn Portuguese to study in Brazil. The other question is, what other career courses is selling in Brazil?
Well, what would I say by selling?
Maybe
In
they
terms,
mean that is
well, that's so
giving
like
money or something.
that question is
Don't
so
power,
Nigerian. That
don't
question
jawo.
that question is so Nigerian because I mean, first of all, you should know what you want, the passion, and everything falls later. So yes, if you want to go into engineering, if you want to go to administration, if you want to go into tech, I mean, I think tech is the future. So that's it.
Okay.
Tech
For
is the
someone come, okay, you can go on, doctor.
no, you can go on, don't worry.
Tech is the future.
Yeah.
For
It's the
someone
present.
coming outside, is the present to. For someone coming outside Brazil to give birth, will you advise them to go for government hospital or private hospital?
The government hospital, like I said, uh, offers almost 80 to 90% of all healthcare system in Brazil. So for you to get to the private sector, you have to at least have money or have health insurance. Yeah. So
Exactly.
like I said, every corner, every state, everywhere you go to, uh, there are hospitals, there are what's it called, emergency points, ER spots where they can attend to you, giving education 24 hours a day, 24/7 a week. So yes, coming to the public sector, you find professionals that are very capacitated, that are very well trained, and yeah. So same thing compared to NHS in the UK. Same thing compared to probably Canada. So, like I said, when I was in school, attended to an Australian. She was she was in labor actually. She was in a final stage of labor, and we gave her assistance without questioning where she was from, without documents and all that. Actually, yeah, just an identity, just to know her name and all that. Well, that didn't like I didn't that would didn't stop her from having a very well uh, planned and competent doctors to attend to her. And after that, she went home free, happy with a baby. Free.
Free of charge. Wow. Hey, doctor, I even heard that some hospitals give you baby care when you just give it, like all these pampers and all those feeders.
Yeah. In the hospital, there are sectors responsible for that. For example, the social service sector, when,
Wow.
for example, patients who are poor, let me put it that way, or who are socially unprivileged, getting there and they don't have much to fend for themselves. Yeah, there are sectors that are responsible to do that.
Wow. Wow.
From clothes to
Mhm.
donations and pampers and all that. Yeah.
Wow. Wow. So somebody is asking that, did you learn the language in Brazil or before coming? You
I did.
learned the language
I
in
think
Brazil or
I only spoke obrigado when I got to Brazil. I only spoke that's thank you. That was the only word I knew, and the rest I had to learn here. So yeah, it's a difficult language. I'm still learning after 13 years. It's a language where you get to commit a lot of errors, but the fact that you are willing to learn it is, I mean, you can learn it in a year or two, but for you to master the language, I mean, depends
Mhm.
on you. Depends on you actually. So, yeah.
Exactly. For someone who studied masters in public health, is there hope to move to Brazil to work?
Actually, it's a little bit difficult here because when you come into Brazil with a foreign skill, first of all, you need to validate this foreign skill in the embassy. And that's what I would advise you guys. So don't just come here with your foreign skill or foreign diploma or whatever. without getting into a process of validating it in the embassy, in the Brazilian embassy in Lagos or in Abuja. That will make your life easier because there'll be a translation, there'll be a stamp of the Minister of Health, and yeah, you get to submit when you get to submit your CV and all that. It's already there. I mean, it's already it's all
approved from the
yeah, approved
embassy.
and it's renowned already by the Minister of Education, Minister of Works. You can easily. So that's the best way. You can actually come with even in whatever you study. It's necessary you validate your foreign what's it called
Certificates.
certificates.
Wow.
Yeah, amazing.
That's cool. Thank you very much, Doctor. So, somebody's asking that if you are to rate the public hospitals to the private one, Tracy, what is it? Why are you comparing public hospital and private hospital after everything we've told you that public
Actually,
hospital?
the private hospital and the public hospital, who work there? Okay, no, we can take the question. It's valid.
Okay. If you are to rate the public hospitals to private hospitals in Brazil for how they are for their patients, I don't understand what she's trying to say. Like for
I
their
think,
patient, how they treat their patients, like how will you rate public and private?
well, not being a bigot, I mean, not being someone who's trying to be. Actually, most times, the treatments in the private sector is different, definitely, because it includes people who have money and can actually easily put you in the justice system if you don't treat them well. While in the public sector, you can also be processed, I mean, judicially if you're not treating them well. But ethics as a medical doctor, you have to treat all patients equally, independent of where or when you're attending them. So I mean, for all doctors, this is well
General code. You
general
must
code. I
code
mean,
of conduct.
code of conduct. You have
You
to
must
treat the
take care of
patients
your
independent
yeah.
of where you're attending to them. Notwithstanding, in the private sector, you have better infrastructures at times, and
Private.
things work faster. Yeah. So yeah.
It's okay. That's fine. So do we have more questions for the doctor before he leaves? You guys should send your questions now. There's time. Our doctor is here to answer all our questions. If you have questions about Brazilian medical healthcare system, kindly come out now and ask us, please. Don't be shy. Where can we find jobs before moving from Nigeria to Brazil? It depends on your job, right?
Well,
Doctor, they're asking where can we.
to find job, well, I won't say depends. It's difficult because you can't say like, maybe in the UK, in the US, you have this kind of what's it called? You have this possibility, right, to get a job even before traveling. But yeah, it's possible to get a job before coming down to Brazil, depending on the skill you have, depending on the area you're looking for, because you can work with multi-internationals, you can work with so yeah, it's possible, depending. But if it's easy, no, it's not easy. It's difficult.
Okay. Wow. Thank you, it's Wings. Thank you, Doctor, for your answers. Do you guys have any more questions? Please come out and ask us more questions. Ask us questions. People in the house, ask us questions. Ask us, you. You type. And Doctor is trying out filters.
Any more questions?
Yeah, we have. For someone, somebody has asked why were you late. So, somebody's asking for someone who has gone through cesarean section, before. What's your advice if that person is coming to Brazil to give birth?
Well, like that's not a problem. I mean, if you have a previous C-section, like I said, when you get here, you need a proper medical attention first. We start from the primary care. and the primary care will refer you to a gynecologist, an obstetrician, where they'll be with you throughout your prenatal, and they'll see risk. They'll evaluate. Right, that's the word. If you are a patient with high risk of going through C-section again or not. So yeah, it means it's individual. I mean, that's not like how can I say it? That's not the main problem. When you get to Brazil, you need firstly a proper medical attention and individualized attention. That's, I mean, I don't know how to explain that in English well, but yeah, C-section doesn't matter. It matters when you get here first. Talk to your doctor. The doctor will see if you have any high risk, depending on your profile as a person. For example, you had a C-section before because you had an acute complication close to your labor. Then most of the time they'll choose that. I'm not a gynecologist, so yeah, I can't answer that question. Probably I have to refer you to to one of my colleagues there. But a C-section is not really that shouldn't be a question.
Shouldn't stop. Mm-hmm.
Stop you.
Like, I mean, I feel like, yeah, you should. I feel like if you've had C-section before, you can also have it again. It's not like something that they don't do here in Brazil.
Yeah, it depends. Having a C-section, previous C-section can be
Is rare.
a previous C-section, and trying to have another one is actually a high risk procedure. So yeah.
Okay. So they might like look for other alternatives for you to give birth, or they may advise you not to get pregnant again.
Exactly.
Which is high risk. Okay. So somebody's asking that are there caregiver jobs in Brazil?
Caregiver like?
I think all these assistant technical nurses.
Yeah, sure. There are a lot. There are technical nurses. There are social service departments. There are workers. I mean, pharmacy, psychotherapy,
caregiver,
physiotherapy. I don't know if that's the type of caregiver you're saying, but I don't know.
Yeah.
Yeah, actually, it's health professional in general. Like,
they're available in Brazil.
Yeah, sure.
So somebody's asking what is the easier pathway to Brazil? Is it through study?
The easiest pathway I think is through studies. And there's scholarship as well for people between the age of 18 to 25. And if you are going for masters or doctorates, the age limit is off, so you don't need to be 18 to 25. You can actually get into masters or a doctorate degree at any age, and it's free and it's funded. I mean, you earn money. They pay you.
Wow, that's amazing. Are you guys listening to this? So somebody's asking, what is it like treating cancer in public hospitals in Brazil?
Well, treating cancer in the hospital, like I said, is free. I mean, everything's free, yeah?
Free?
Public sector, yes. Treat cancer, heart surgeries, transplants. Yeah.
Wow. My community people, are you guys listening? Free. Land of honey, milk and honey, free. Another question is, what are the requirements for a Nigerian to gain admission into the Brazilian university? So Connect, I have this answer on my YouTube channel. Kindly click on the link on my page, on my bio. The answers are there. Several videos on how you can enter into university, Brazilian Federal University, through admission from Nigeria. Because it's a long story, we cannot finish it this night. So I admire your work on your page. They allow you to take pictures of your surgical processes in Brazil. Exactly. Doctor, this question is for you.
Well, taking pictures actually is really not. You can take pictures without the patient's authorizing that.
Oh.
show your patient as well the face on Instagram.
Wow.
You can just show. I mean, I have a page. I have a photo on my page where I actually was doing a procedure, but with total concept of the patient previously, and hiding his identity. You can't post your patient's identity because there's something we call medical patient. What's it called? Relationship, where you are like when you go to your father, like, what they call that, when you confess, like you are secret keeper, apart from being a doctor, apart from being an health provider or an agent, right? You are also a secret keeper of each patient. So you can't discuss that publicly.
Okay. All right. Thank you very much. So somebody is saying landing pregnant in Brazil. What are the first steps to take as a pregnant woman?
As a pregnant woman, well, if you're coming down to Brazil, like I said, get a visa first. Probably you might want to get a visa. Probably a tourist visa can work. But at times you can also get what's it called, an health related visa that permits you to come down as well for medical attention. Yeah, so yeah, and it's free.
Okay. Wow. So this is the last question we're taking so that the doctor can have some rest. Someone said her husband has kidney failure, and then in Nigeria they have turned to beggars just for him to have dialysis.
Yeah.
So our question is, can they see a doctor over there that can send him an invitation to come to Brazil?
Well, this invitation thing depends. It has to be, for example, it has to be someone someone who can really assist you on that. For them to come down and take dialysis. Actually, dialysis are free as well for the patients, although there are a lot of problems in the public sector due to the amount of patients and the number of machine needed or available for weekly dialysis in some patients. So yes, it's possible to get a doctor that wants to treat you, but this doctor has to know you first. And the private sector too exist for cases like that, but yeah, your pain is not free, and it's more expensive because compared to a public sector, the private sector, you have to, like I said, you have to pay. The price varies from hospital to hospital, from centers to centers. In the public sector, it's totally free, but there are a lot of bureaucracy for you to get there.
Wow. Thank you very much, Doctor.
Wait, can you give me just 1 minute? I'll be back.
Okay.
I'm not going off.
Okay. So you guys, thank you so much for your questions. If you have more questions, kindly send them over to the doctor. He has your time today. Today is Doctor's Day for answering questions about medical healthcare. I won't be going back to this question today. When I'm done, I'm going to go and edit video for you guys on YouTube so that people that have missed this live now, they can watch it on the YouTube channel there. So if you have any questions now, so you don't enter my DM and I don't reply you, you say, hey, but you're online. No. If you have questions now, ask.
Yeah, I'm back.
I'm here to answer your questions. All right, welcome back, Doctor. Somebody's asking, is it possible for the husband? Okay, somebody is trying to ask about the other lady that has her husband has kidney failure. So she's asking that, is it possible for that woman's husband to come in as a private sector patient and change to public?
Yes, quite possible.
Ooh, wow.
I mean,
how can she go about it, please?
Well, first of all, getting a doctor, referring her to a doctor who can handle the case in the private sector, and later seeing, probably after some session, you can usually ask them to refer you to public sector where
it's free. Wow. I hope she's still here on the live. So somebody has opinion that you can bring your husband to Brazil for free dialysis through private sector. You can maybe, how do I say it? You can find a private hospital online that is in Brazil. Just pick a country, pick a state rather. Find a private hospital. I think apply for dialysis or something.
No,
apply for it. Or how do they go about it?
It's easier. Well, it's possible. What you just said now is possible. Like getting in touch, direct contact with the hospital through email, through call, and they give you feedback on how they can go through that. Because it's quite difficult for well, in my own little experience, for some private sectors to have foreign patients. I mean, getting in touch with them on a foreign soil. So yes, if you do that, probably someone will get interested in that, and get back to you.
Okay.
And,
well, what I think they can do is like when you search for a private sector hospital, you can look for their email. They always tend to reply to emails. Check emails and send them professional messages, maybe in Portuguese or something. Or what do you think, doctor? I think that should be
that is
smart.
that is possible. That is very possible. I mean, you can send an email, wait for the reply, and yes, you're good to go. So with them replying to you, you can use that as even an invitation letter, like when you're submitting your application.
Exactly. So I am Abam Hope. I hope this question about your husband's dialysis has been answered. We're wishing you very good luck, and then we're wishing your husband very good luck too. Also, every other person, please, you have more questions. Doctor is here today. Ask question. Ask question. Ask. You're welcome, Hope. You're welcome. We're wishing you good health, wishing you love, wishing you comfort. Praying that the Lord touches your husband and you too. Amen. So every other person, if you have questions, please go ahead and ask us questions before we call it a day. Because it's already evening. It will be like, give me time, you see. It's already 7 p.m. here. Like 11 p.m. in Nigeria. 11 p.m. Wow. God will forgive you. Oh, fine, bye. What did you make up?
Wait, is there any other thing I can help with?
So I hear that doctors earn a lot of money in Brazil. Somebody's asking you.
Anyways, like I said, doctors don't earn much like they deserve. That's it.
Yeah, you already said there's no amount of money that is enough to pay doctors. They will have to pay them the entire, in fact, zillions, billions, zillions.
It's not that.
There's no amount of money.
It's not that.
And you guys are doing a lot of work because after God, you understand? God is using you guys to help the general population. So there's not enough money that they can pay doctors. So there's not enough.
I think it's worth it being a politician. Anywhere in the world, being a politician, then you're good.
Exactly. Someone is saying they appreciate you, Doctor.
Thank you, Third Wing.
Midwing, Third Wing. Thank you guys very much. I think we have come to the end of today's live. Thank you guys for always consistently supporting and watching my YouTube videos. I'll be making more videos for you guys on YouTube concerning this healthcare, to expatiate and break it down to, simple English and Yoruba for you guys. So thank you guys so much. I think we have come to the end of today's live. Thank you guys for always consistently supporting and watching my YouTube videos. Hello, doctor. I'll be making more videos for you guys on YouTube concerning this healthcare, to expatiate and break. Okay, so somebody's asking that, doctor, is it possible to communicate with doctors before coming down to Brazil?
Yes,
as a CS patient.
As a CS patient, yeah, it's possible. Definitely, I can even refer.
Okay, so doctor said he can refer you to a doctor. So I will get the referral and give it to you and his airline. So be in my DM and his airline. Don't go to doctor's DM. Oh. He will not reply in 10 years. So if you want faster response, send your inquiries to me. Doctor, we also wanted to know, are you single?
Well, I'm single, yes, I am.
Give it to you and his airline. So be in my DM and his airline. Okay. Don't go to so my followers, my community people, you heard, doctor said he's single. If you are single too, I'm not saying don't go to DM for that one, no. But question concerning healthcare, you can ask me, then you get answers from him.
Well, thank you very much, people.
Thank you, guys.
I hope, right? I was able to contribute with something, and I'm happy for the invite, right? So definitely in the future, whatever questions you have, whatever that's bothering you, health-wise, right? You can get in touch. So feel free. Yeah, God bless you guys.
Thank you, doctor. Thank you so much. How do we remove you from the live like this now? Do you know how to leave?
Let me see. I can leave. Yeah. I'm sorry.
Okay. Thank you. We appreciate you a lot. Many hugs, many kisses. Thank you. God bless you. Thank you, everybody. Please don't forget Annie's airline. I cannot forget it. That's a very serious.